All right, go ahead, Adam.
Wait, I don't want this recorded. No, I'm kidding. Got it. All right, can everybody hear me? All right, cool. All right, so my name's Adam. You can see from my screen. I've been with Epilepsy Families Southeast Wisconsin for about 1.5 years, and from these presentations, we've gotten a lot of great feedback just on knowledge of seizures and epilepsy. Granted, a lot of times you have to call 911. That's a common, but actually, I'm filling in for my colleague who does library presentations, but I used to be a librarian. I should know this. So let's talk a little bit about us. So Epilepsy Families Southeast Wisconsin is an independent nonprofit epilepsy charity founded in 1954. We've probably had 1,000 names since then. But our mission of our organization is to increase public awareness in epilepsy and to support and empower people affected with epilepsy and providing education, or like I said, I have a bad eye thing. Direct personal assistance through advocacy and education. And we offer help and hope to Wisconsin residents who have been diagnosed with epilepsy. And let me add to that, if you go to our website, you'll see that we actually, for free, we offer emergency medication for epilepsy, referrals. We sponsor family events and other hands-on benefits to epileptic communities and their families. Excuse me again. Our outreach is very local and personal, so we very much encourage people to kind of put our name out there, because what we kind of do is pretty unique. So, all right. What is epilepsy? Okay. Epilepsy is a common chronic neurological disorder characterized by unprovoked seizures. A seizure is a sudden burst of excess electrical activity in the brain that causes a temporary disruption in the brain's behavior. Diagnosed epilepsy, you have to have 2 or more seizures, but being in a library, I can tell you I've witnessed I used to work at Milwaukee Public Library, and I witnessed 6 seizures. So it's kind of hard to discern, like, when to call 911. So it's probably your best bet at the library to call 911. But we also know that seizures are excuse me, they're not just caused by epilepsy. They're caused by medical interaction or medicine interaction, high fever, alcohol, to name a few. So I can actually tell you from experience, I got prescribed a medication and I had a seizure. I only had one, but it did not work well with me. So what is epilepsy? Epilepsy is not rare. Over 60,000 excuse my cough, I'm sorry. over 60,000 Wisconsin residents have been diagnosed with epilepsy, and unfortunately, 10,000 of them are children. And 2.5 to 3 million people in the US have epilepsy. That is twice the number of people living with cerebral palsy, muscular dystrophy, multiple sclerosis, and cystic fibrosis combined. Excuse my cough. So epilepsy is the fourth most common neurological disorder in the United States. That's following migraines, stroke, and also Alzheimer's. So what does that mean? That means 1% of Wisconsin, and of those cases, 1/6 are children. Reading those stats, you may be like, okay, well, but you might notice something, and when you watch the TV, you don't really see too many epilepsy commercials. So, but I've worked with many people that have epilepsy, and being ignored is it's offensive, and it's hard on them. So it's a very very debilitating disorder. People that have epilepsy need to know, like, they have to change their lives to actually have a good and stable, independent place. So these are the types of seizures. Grand mal. This is the one everybody thinks of when somebody has a seizure. This one is the type of seizure that causes rhythmic jerking, falling down, brief unconsciousness, and they tend to last, if it's a, I can't say healthy seizure, but if it's a normal seizure, they last to about 1 to 3 minutes. So the reason this one stands out is because this one is the people that see the most. And being a librarian and witnessing 6 seizures and having the public witness this many, like 6 seizures or more than that, I wasn't maybe even working during that day. People get very scared, and good reason, because it's a very scary disorder, and people tend to call 911, and that's okay. That's okay. So absent, excuse my cough, absence seizures. These are seizures that tend to happen with children. It's almost called multiple daydreaming. Teachers, I'll just say, for example, because I usually give these presentations to teachers, they usually will, well, this is what I'm teaching them not to do, but if you're caught daydreaming, like, you tend to get like, hey, wake up. But these seizures that these kids are going through, they're not normal. They black out. And there are certain things you have to look for, like blank staring, fluttering of eyes, changes in excuse me, muscle movement, and like smacking of lips. But a lot of people just don't see that. So, but this is different than a classroom that I'm talking about. But like I said, people with absence seizures, they're completely unaware of their surroundings. They last about, like I have a tilde there, 10 or less, 10 or less seconds, and they're completely or frequently missed by observers because they just happen so quick. But they often happen many times in a row. So to me, being part of this organization, blackouts are really scary, and your body is functioning, but it loses capacity to remain memories. Some adults may have experienced that type of blackout sometime in their life. No judgment. But as a child, that's got to be very, very scary. And to have a kid in your library just black out and just not know what's going on, it's an extremely traumatic, problem. As librarians and the general public, you have no advanced knowledge if a person has epilepsy. Don't bring attention to a person in front of others. We want a person to be safe and not embarrassed. That's essentially what we're going for here. But sometimes you need to call 911. Excuse my cough, God. All right, causes of epilepsy. Any event from faulty wiring during brain development to physical injury or infection can lead to seizures or develop into epilepsy, which is, when I learned that was kind of crazy. It can be difficult to diagnose epilepsy. A major challenge when diagnosing epilepsy is identifying what caused it. Unfortunately, the root cause cannot be determined from 6 out of 10 people with this condition, but I want to definitely remind you that it's not contagious. Again, epilepsy is like, it doesn't discriminate. There are factors out of human hands that may develop into epilepsy because the diagnosis is hard to pinpoint, but it may lead to a person's frustration as to why they have this disability. I'm sure we're well aware of this. This is a neurological disorder. Comparing this to saying a brain tumor or depression is contagious is just not true. Explaining to people that it's not contagious may take away some of their fears. Causes of epilepsy. Infants and children. Epilepsy in this age group often results from brain injuries or early life brain damage, unfortunately. Young adults can develop epilepsy due to head injury or some other form of trauma to the brain. And as said before, as adults, most common are stroke, Alzheimer's, and head injuries. As you can see, there are wide ranges of causes of epilepsy that vary by different age groups. So, who has epilepsy? Epilepsy does not discriminate. Children and adults, men, women, people of all races, religions, ethnic backgrounds, social classes can develop epilepsy. It does not discriminate. 3.4 million people in the United States alone are living with epilepsy, and 150,000 new cases are diagnosed every year. I think I might have talked about that stat earlier, but around 50 million people worldwide have epilepsy, making it one of the most commonly neurologically diseases globally. So I can say that surprised me. But again, I'm repeating a stat. Currently 60,000 people in Wisconsin or residents have been diagnosed with epilepsy, and 10,000 of them are children. How is epilepsy treated? Currently, there's no cure for epilepsy, and I'll be frank, it sucks. 1/3 of people diagnosed with epilepsy live with uncontrollable seizures because there's no available treatment that works for them. The remaining 2/3, however, can reduce or stop by having seizures with proper medical treatments. Doctors can treat most forms of epilepsy with medication, brain stimulation devices, diet, and in some instances, surgery. Medication. Many anti-seizure medications can have a undesirable effect on patients, but that doesn't mean it doesn't work. But they have to experiment around to see which one works. Some people, which is unfortunate, have it's called a drug-resistant epilepsy, and that means they can't take any form of drugs, and they have to go to the next form, which I'm going to talk about. It's brain stimulation implants. Brain stimulation devices have been successfully used by many people that have been diagnosed with drug-resistant epilepsy. And essentially what these are they're implants in the back of their neck or in the back of their head, which have to be obviously updated with their neurologist. But I've talked with many people and went to many seminars, which they've had a very good effect compared to people that can't take medicine, because it's just, yeah. Anyways, how is it treated? Dietary therapy. I think people have heard of the ketogenic diet, but this is the most popular diet for people with epilepsy because when people go through this diet, it actually causes a metabolical state called ketosis. which it mimics fasting, which helps the brain prevent seizures. So that's why that's the most common diet. Brain surgery, that's kind of a last resort for people, but if people need it, that you know, they have to get it. Critical seizure information. Chances are high at some point in your life you will witness a person having a seizure. Like I said, I've witnessed 6 before administering first aid. The following information is critical to understand before attempting to help someone having a seizure. You will be in an extremely stressed situation, so the best thing is just try to keep calm. So first thing, never restrain somebody that's having a seizure. Never. Forcing anybody down, like, they're going to hurt themselves more and you might even get hurt. But it's just that's probably a priority. All right, so second of all, never force something in the mouth of somebody having a seizure. This is a very old myth that a person can swallow their tongue, and that's physically impossible to do so. If you guys want to take a few minutes and try it, I say go ahead, but it's impossible. But trying to force an object into somebody that's having a seizure, it can do a lot of damage to them, and they can also do a lot of damage to you, because their jaw and their biting down is just uncontrollable. So just you can't do that. So all right, lastly, timing a seizure is crucial. I know it's when you see one, everybody's, like I said, like I've seen a bunch, and like I never thought about timing, but the thing about seizure first aid or information is noting the time. Seizure, excuse me, going past 5 minutes, you should definitely call 911, or you should call 911 if you don't feel comfortable in this situation. I've been in a library. I know it's very weird. Anyways, this is just a visual of turning somebody on their side when they're having a seizure. This doesn't have to be done, but if you see somebody foaming at the mouth, it's probably in your best interest to turn them on their side, just so they don't choke on their own spit or vomit, if you will. So it's kind of it's up to you, but I mean, I guess the best bet is to turn people on their side, just so you don't even have to worry about that. So that's my idea about it. So seizure first aid guidelines: loosen tight clothing around the neck. And I know at libraries, most people wear ties. That's a joke. Anyways, so if they're wearing tight clothing around their neck, or anything that would seem that would be constricting, try to loosen it. I guess whatever resources you have, you want to support their head, because that's kind of the most important part, because that's where your brain is. Secondly, or thirdly, check for a medical ID bracelet to see if there's any specific plans or who to call or what to do. Fourth, stay with the person until the seizure is complete and they are alert. Then sit with them until they're up and comfortable. And if they feel they need an ambulance, definitely give them, obviously call an ambulance, but just make sure they're okay. And if they need more medical attention, give it to them. All right. So, yeah, this part's tough. Try to have an assistant, and if possible, try to keep all the patrons away as you can. A lot of people, or when I was at a library, like a lot of people are just interested when this happened, it was, but the less people that are there, the more effective the first aid is going to be, because people aren't going to be watching or freaking out and trying to help when they don't know what to do. So, and the last point is, again, when they're back to their capacity, check their medical ID bracelet. And some people actually have a personal seizure action plan, which we're actually going to be handing out soon. So, but just to make sure, like, who to call, what kind of seizures they have, essentially just emergency phone calls, and just what to do in case they have them and what care to take. So call 911. All right, I do schools, but this one's a little different. If there is a head injury, definitely call 911. First time seizure, you don't know that. So like I said, sometimes your best bet is just calling 911. Seizure lasts more than 5 or more minutes. Again, you're at a library. Yeah. Person has repeated seizures. Seizure occurs in water, which I know libraries are full of water. If the person is pregnant, injured, or ill, I mean, just call 911. All right, I probably shouldn't have just said that, but all right, so we improve lives. Here's the same stat. Currently, over 60,000 Wisconsin residents have been diagnosed with epilepsy. 10,000 of them are children. So we offer specialized programs and services to communities throughout Wisconsin. Epilepsy Families is dedicated to optimizing equality of life for individuals and families dealing with epilepsy. We work directly with our clients who identify how we can best meet their needs. And when we call ourselves Epilepsy Families, because epilepsy it affects so many families rather than just the individual. So that's why we call ourselves lit. So again, the mission, our mission is to support and empower people affected by epilepsy and providing personal assistance, public awareness, community education, and continuous advocacy. And I guess if you know somebody or anyone that could use our services or benefit from our help, we definitely ask you to refer us. So, all right. So that's the end of my presentation. I want to thank you for taking the time to learn about the important information that could possibly save a life at your workplace. I want to thank Kara and the Oregon Public Library for inviting me to give this presentation. And I will take questions if anybody has any.
Can you explain the difference between epilepsy and a seizure? Because I see it referred to as two separate things.
Well, epilepsy is it's a disorder that you have multiple seizures, and like I said in the presentation, you have massive neurons that interact with your brain, but a seizure can essentially happen to anybody. Like I said, medically or with medicine, high fever, alcohol, and that's just to name a few. Seizures they're not very rare, I guess you could say, but in the medical world, you have to have 2 or more to actually be diagnosed.
So in other words, I mean, so epilepsy is clearly defined by seizures, but not all seizures mean that you have epilepsy. They can be due to other causes, such as the ones that you mentioned.
That is exactly what I'm saying.
Okay, and so then in terms of how to care for somebody who's having a seizure, because we won't really know if they have epilepsy unless it says it on a medical bracelet or something of that nature. The kind of like the first aid or the way that you would respond, though I'm guessing is precisely the same.
Well, if you don't know the person, I would suggest calling 911.
Okay. And I guess that's the other thing is, if a person is having a seizure, you're saying not to restrain them in any way, but to make sure at least they're in a safe place or position.
Correct.
On the floor, ideally, would make sense, I guess. And you should never leave them. So if you had to call 911, I mean, you either have your phone next to you or you have to get up and find help in order to do that, right? Or should you just leave, like, should you just stay with them for a couple of minutes and then determine, you know, okay, this has gone long enough, I should call 911. I mean, I guess I'm just not clear how to respond to somebody that might be having a seizure.
All right. I guess I'm under and this may be naive of me, that most people have cell phones. So, but the number one thing to do is keep them safe while they're having a seizure. But I would hope somebody would be around that they could call 911. But if you do have to leave them, make sure they're in a safe place. Make sure they're not going to injure themselves, and grab a phone, call 911, and go back to them and make sure they're safe as well.
Okay.
Do you get what I mean?
Yeah. Yeah.
So, I mean, I guess I don't really know how to explain that, because everybody has cell phones now. So
Yeah, I guess in the nature of my work, I don't have my cell phone on me. And so I'm just in interaction with individuals doing like private yoga and meditation sessions. And so having the cell phone is not really part of the, that would be sort of a distraction. And so I'd have to step out of the room to go get it. But I do know of at least one client who sees me on a regular basis who does have seizures, and has not happened in my presence other than a small one, like you were talking about, kind of like sort of like a kind of like the small little jerky movements, but not where they've like fallen over and went into like a grand mal seizure, or have had sort of like a blank stare to them at times and unresponsive for like just a brief moment. And so that's part of the reason that I signed up for this class, was just to understand how, because I think the potential is there that this individual could have a seizure while he is with me. And I'm just not sure how to respond.
Do you give private classes, or are they public?
They're individual, they're private individual one-on-one sessions.
Okay.
Yeah. And so he's dropped off by a caregiver, but that caregiver doesn't stay.
Right. Like I said, we're not medical professionals, but I think there'd be enough time where you could just call 911 and go right back to him or her.
Okay. Thank you.
So, I can get back to you and give you a better answer, but I think that might be the best option.
Yeah, I was wondering too, like if your organization had any sort of like quick little handouts that I could have handy at my facility. Just because, I see so many different people and then I forget, this training is helpful, but then I forget. And so if you have something like that, I think I could benefit from just a kind of like a quick little seizure first aid, what to do.
Yeah,
kind of
I gave one to Kara, right? Could you forward that to Kelly?
Yes, I will send that out in a follow-up email to everybody who registered. So definitely.
Okay. Yeah, it's a form I created. It's a 5-step how to deal with a seizure that's going on, how to deal with one that's going on right now. So it's a good form to just have around. So you can easily hang it on a wall or quick pick it up, and you'll know what to do. But again, calling 911, probably your best bet. Yeah, that's probably your best bet, because has he told you what kind of epilepsy he has, or?
And I'm not, well, if you have more than one seizure and that's what constitutes epilepsy, then I am guessing that's what he has. But he also has very complex medical conditions that I think brought on the seizures. So I don't really know the full nature of what's going on with him physically. I just know that he's had some very, very severe seizures, not in my presence, but there was concern over the loss of his life. So yes, I know it's something I need to be really conscious of and aware of how to handle it should it happen in my presence.
No, I get what you're saying completely. But asking like too many medical questions, that's, HIPAA. You're going over HIPAA law and all that other stuff. But unless they want to reveal that to you, that's fine. But actually, if he or she feels comfortable, I forgot if you said it was a he or she. If he feels comfortable telling you what he has specifically and how you can help if something does happen, I think that would be more beneficial to you.
Mm-hmm. Yeah, I think that's a good idea.
And to him.
Mm-hmm.
So I would find out if he would be comfortable talking to you with that, just because you want to make sure he's safe when you're at, he's at your workplace, right?
Yeah.
So if he wants to, divulge that information to you, he can. But if not, then, that form that I gave to Kara, you can use that, or 911, I guess, is a good resource.
Yeah. No, I appreciate that. And fortunately, I'm right next to the fire station, so I guess I have a lot of help really close by if I really needed it.
Well, if you can't even go to a phone, you have to run to the fire station. Come on.
Yeah, that would be like the worst case scenario, right? And it wouldn't be too much further past where I'd have to grab my phone.
Yeah, I can't get to my cell phone, but I could reach. I ran a mile to get to the fire station. All right. Well, I hope that was somewhat helpful.
Yeah, I think to me, it's just reassuring because I think there is a sort of fear that I have, I think as many people, it can just feel scary to think of someone having a seizure and wanting to do the right thing. So this has been really reassuring in many ways too. So I appreciate that.
Well, good. That's what I wanted to do. But epilepsy is actually called a ID, invisible disability. Just like depression, anxiety, stuff like that, until somebody has a seizure. So everybody tries to keep it like a secret. So yeah, so you just got to be really aware and make sure everybody's safe. If they tell you, if they are very open with you, then you are very lucky. But sometimes people don't divulge that information, and that's when stuff happens that's not good.
Mm-hmm.
So like I said, I hope I answered that properly. So
Thank you.
anybody else?